Thank you very much for the wonderful seminar. I would like to ask you questions relating to today's seminar. To begin with, I would like to know what brought you to perform the research. Why did you start having an interest in probiotics? Well, I have been treating periodontal disease by employing a full mouth disinfection approach with antibiotics for a long time. This approach is very effective indeed. Though periodontal disease is an infectious disease, we have been treating it surgically. Historically, a pocket reduction approach has been taken, which aims to make an uninhabitable environment for anaerobic bacteria, periodontal causative bacteria. Because anaerobic bacteria increase in 5 mm or over periodontal pockets, we try to reduce the number of these bacteria. But see, we find it contradictory. Is it really good to plunge a scalpel into an infected site? Actually, we have seen adverse effects, such as cardiac disease or cerebral infarction caused by bacteremia the patient got from the site. This is why from 1980s to 1990s, before an age of surgical treatment, a concept of antimicrobial therapy was born. But this was hardly adopted in Japan. I started appealing to the necessity of this procedure in Japan. And lucky enough, I created the procedure of drug administration based on a bacteria test. Later, many patients received benefits. However, we still have final issues to deal with: development of resistant bacteria, microbial substitution, and prohibition from administering antibiotics in pregnant or lactating mothers, as well as patients with systemic diseases. These patients are categorized into a group, not being able to be cured. So I thought we wanted to help them. And I've been choosing a method by trying several ways. One of them was a topical disinfection therapy. This was good too. However, unfortunately, it is not effective at all in patients with serious infectious disease or patients whose periodontal system has advanced to a bone. I needed to find something better. Then I got to know about probiotics, which made me think I want to introduce this concept into actual clinical settings. I believe that the principle of medical treatment is treating everyone without exception. We should not leave any patient saying, "Sorry, we cannot help you." I sincerely believe that we, medical professionals, should treat any patient with any disease in any way we can. Thank you very much. I've heard the word bacteria test many times from you. On the other hand, I've hardly heard the word from other dentists, though I have had many chances to talk to them. Of course, they are aware of its existence, but they are unwilling to conduct a bacteria test because it is not cheap. It is very costly for patients. In that sense, it seems they are prescribing a lot of antibiotics without knowing which bacteria are present inside the patient's mouth, like, let's see if this drug works. We are afraid some of dentists are like that. What do you see this issue, importance of bacteria tests? I believe bacteria tests are essential when we provide disinfection treatment or treatment for infections. Let me give you an example. When a patient has a flu, a physician cannot prescribe a drug without testing to see if it is type A or B. This is logically correct. Nonetheless, there are some cases where the procedure is impossible to follow. For instance, a case where a patient cannot survive without being administered a drug, or a case where other family members will be infected. In that case, prescribing antibiotic drugs with broad-spectrum antiviral activities is an option. It is regrettable to say that it is a big concern in today's dental treatment. In short, if we prescribe an antibiotics with broad spectrum, it will work in most cases. By keep doing this, we will have serious consequences in several years, namely developments of many drug-resistant bacteria. It will become more difficult to treat. For this reason, we should conduct a bacteria test first and use antibiotics with narrow spectrum by focusing on causative germ. This is fairly ethical. Then next issue is this covered by health insurance? The answer is no. This is a present status to be regretted. Then a new idea, probiotics, has come along. The concept is totally different from the current one, killing good and bad bacteria all together at once. The concept of probiotics is to prevent diseases by recovering bacterial flora in the gut. It has three elements: treatment, prevention, and treatment before onset of disease. Dr. Yoshino, you mentioned several times control of bacteria or control of oral bacteria in today's presentation. Give us your idea on how important it is in the field of dental treatment. How will it be accepted in the future? The basic idea of dental treatment came from surgical treatment. If you find a lesion, take it out. This is a fundamental idea. Consequently, if you find a decayed tooth, drill it. If you find tartars, scrape them. However, in terms of surgical point of view, why causative bacteria for oral cavity are present there or why periodontal bacteria are present there are irrelevant. At least, that is not important. Whereas physicians have questions: why bacteria exist and what infectious routes they took. In other words, conducting a test, treating with a drug, but not perform an operation is an inspiration from physicians. Conventional dental treatment is dental surgery in English. Dental treatment is surgery in itself. By incorporating an idea of oral medicine into the traditional dental treatment, we will bring about a new concept. It is a shift from cutting, drilling, and scraping to controlling of conditions for recovery. This is why I think it is essential to introduce an idea of control into dental treatment. There is an oral medicine field in overseas countries. Do you think it will come to stay in Japan? That is called periodontal medicine. It is not oral medicine. Territory of oral medicine is limited to inside of the mouth. It is not right to place the oral medicine being surrounded by a bigger circle of internal medicine, I should say. I see. This is because tonsil, esophagus, and air passages are all connected to the mouth. But if we say those parts below the mouth are irrelevant to dentists, as our license is different from doctors, internal medicine should be associated with all parts of our body. And to find a cause for a systemic disease is what periodontal medicine or oral medicine is expected to do. Oral medicine in Japan has a stance: we do not cut and we treat with medicine. I really understand what you mean. If you translate the word oral medicine into Japanese, what would you call it? I think it would be better not to be translated. We have been trying to find the right Japanese translation for the English terms oral medicine and periodontal medicine. But we call CT as CT, MRI as MRI, without making unnatural Japanese terms. Yes, that's true. Real meaning or concept will get through if we don't translate the words. Thank you very much. I'm glad to hear your opinion on this issue. Since you chose to use Biogaia's Reuteri in your research, I would like to ask you how you thought of our products. What are the most impressive characteristics of our products? The reason why I use Biogaia's Reuteri is there are many commercialized lactobacillus products. But I think the most important point to choose a product for a new treatment is that the product is supported by basic research evidence. How reliable the evidence is, I mean. I do not trust products just by hearing, maybe this is good, it seems effective, or it did well in vivo. I do not regard them as safe. Medical professionals should achieve accountability. Otherwise, it is just rumor. In order to introduce a new treatment, we have to make sure that the treatment is evaluated in a high-level research, and there are a number of epidemiological reports. These points are essential. In that regard, I thought Reuteri is excellent. On the other hand, there is no epidemiological research in Japanese, which is a downside, and it made me decide to do a research. Thank you very much. I wish our colleagues in Sweden would hear this part. Some of our Swedish colleagues say it is not necessary to conduct a Japanese study, as we are all human beings. But Japanese dentists and doctors say studies need to be conducted in Japanese. In fact, I wanted to reconfirm if their view is right. Dr. Yoshino, since you have extensive knowledge of situations in both Japan and overseas countries, I would appreciate your explaining about the importance of studies in Japanese subjects to our people outside of Japan. Very firmly, please. We conducted the research in Japan because we needed to collect data on Japanese. Yes, we are human beings. Caucasian, Black, Asians, we all are. But we have different lifestyles, especially dietary habit. It is absolutely different. On top of that, Japanese intestines are 3 to 4 times as long as that of Caucasian. Our microbial flora in the gut must be different from theirs because of its length. We may have to increase or decrease the dose amount because of the length. We have to investigate on the particular drug's efficacy to begin with. I would like to ask you 2 more questions before closing the interview. Listening to your presentation, I have begun to feel that we are now standing at a turning point in Japan. What kind of researches should be further conducted using the result from your research? What kind of merits will Japanese dentists enjoy by the introduction of bacteria therapy into a clinical setting in terms of economic point of view from dentists? We were fortunate enough to have been able to obtain marvelous results from the research. Firstly, the results were equivalent to that of treatment with antibiotics, or even better. Secondly, there was no change in total bacteria count. Normally, good bacteria are killed by antibiotics, which will make total bacteria count smaller. We can say one of the most wonderful findings was that probiotics improve the intestinal environment by controlling the balance between good and bad bacteria. Then I would like to discuss what we have to do from now on. This research was performed by using only probiotics. So I'm sure if we adjunctively use root scaling and brushing training, the results will be even better. If we can control bacteria count without decreasing good bacteria count by doing SRP training or brush training, it will be a groundbreaking periodontal treatment method because we will rarely have to use antibiotics. This is what we should do next. After that, we will be able to measure antibody levels or white blood cells with an easier method than blood tests, as patients will have higher immunity. So we can collect blood samples at first and store them for a certain period to evaluate how the immune system will change. The conventional dental treatment has not been able to change the immune system, which is why we had to take out causative bacteria proactively. It might have been overtreatment the conventional method was. I would like to elucidate this point from now on. I would like to move on to the next question. How can we utilize biotherapy in our daily practice? As I said several times, probiotics are food, not drugs. Since we eat them, we can interpret approvingly that probiotics has nothing to do with medical treatment. We have been facing a complex issue till now, medical costs covered by insurance and not covered by insurance. If a test fee is not covered by insurance, patients do not want it. Same is true with the case of disinfection treatment. Patients do not want to receive disinfection. Furthermore, since treatment covered partially by insurance is not allowed, if they want it, a patient has to pay the cost at his own expense. We even have to ask a patient to pay for the expense of medical costs. We may be released from the dilemma. Let me repeat once again. Probiotics therapy may be as efficacious as drugs, enhance the immune system, improve health by taking food instead of drugs, and it is not as expensive as drugs. I believe it will be beneficial for dentists in daily practice. We may see patients who say, I had diarrhea, but it is gone thanks to this probiotics product prescribed by a dentist. In fact, not a small number of our patients have cancer. All of them have a weakened immune system, so we provide oral care for them. If our oral treatment will improve their immune system, it will be really wonderful. We also have diabetic patients whose immune system is weakened. Conditions of these patients will be alleviated or improved if we are involved. I am sure probiotics therapy is one of the most breathtaking and promising method of all.